Welcome to my podcast. Today I'm going to talk about another STEM from the entry examination to School of Medicine. So the STEM states most drugs are only available in the UK with prescription. However, some simply can be bought over the counter. So the question was about what's the benefit being able to buy, obviously, the medicine over the counter. And so it says identify two potential benefits of being able to self-medicate. Please justify your reasoning. So only one of the candidates could not understand what it means self-medicate. This means like you treat yourself by your own, having the knowledge or searching or exploring or whatever. So the indicative responses here, it could say, for instance, this will relieve and reduce the pressure on the NSH and the GP for minor alignment, because the GP and the NSH, generally speaking, it's understaffed and stretched. So this will save time. It's quite swift and to the point. So treating common condition like, for instance, flu, cold, headache, or mild digestive issue at home, help reduce demand and overstretch NSH services, and also it will save you the time from the long wait to be seen. So it's obviously shorter time, waiting time, and patient or people self-manage minor health issue. It's freedom from the appointment for those might need it for serious condition. Another thing one of the candidates mentioned, it's going to save the prescription cost, which is actually nearly £10 per, of course, per prescription, and depends if it's full or maybe 2 or 3 prescription. So this is like in terms of cost effectiveness, so it's going to save individual and the system, and avoiding by that the prescription fee. While the care is free, but obviously if you go for private consultation or prescription, it also can be costly. So the OTC medication often is a cheaper alternative, like for instance even paracetamol, if you can buy it over the counter, is more cheaper than a prescription one. And it's on the other side, it's going to lower the public expenditure, and responsible self-care, and can reduce, it will enhance self-awareness and will reduce the burden on NSH resources, which includes, of course, prescription and emergency services. It's also going to give the sense of empowerment to the patient, and will increase their literacy levels, because they're going to read about their condition, read about the medication for the simple alignment, so they will be more knowledgeable, more they will be in charge of their own life and personal responsibility, so people will feel more engaged in managing their life, their health, and learning to recognize symptoms and choose appropriate treatment when needed. And it will boost their confidence, because managing minor conditions independently can build up trust in one's ability to make informed health decisions. And the other thing, it will improve access, of course, in the rural and under-reserved area. So it will be like their best approach. And of course, there should be a pharmacy or something around that area. So it's a pharmacy-first approach, with many UK community relying on local pharmacies. So self-medication will support access to the care, where GP services for minor condition or blending self-care with professional guidance could be, for instance, could be little or few here and there, and patient, maybe they are elderly or sick, they're gonna save them the hassle of traveling and taking the OTC in a nearby place. Like for instance, in the UK, there is different shops. They have a sector or a aisle for just simple medications. Say for instance, for constipation, for flu, for headache, for period pain, general pain, all sorts of painkiller, and certain nasal drops, eye drops. Simple insect bite. I'm trying to remember what sort of things that I've seen in different aisles and shelves in the shops or supermarket or generally speaking any store. So it's like it will empower their ability and accessibility when it's needed to be in charge of their self. And the second question was, in the UK, antibiotic medication can currently only issued by prescription. So if it was the other way around, what potential implication could rise from the antibiotic? And so some they answered quite straight away, and some they struggled, needed some prompts more than once to understand the thing. So the major thing here can be diverse, can be variable. However, the first thing that for the answers is like that not everything needs antibiotic, and if antibiotic is abused, like in certain country, it can be used and misused by many patients for different things like viral infection. I remember some few of the family who were only taking antibiotic for whatever they have, and they think that this will be improved. And this will, of course, with time, will cause antibiotic resistance, which is a common thing nowadays, and also in the UK it's happening. So this will lead, of course, as I say, misuse and overuse, and this will be a major public concern, which is also identified in the UK, and in Oxford they're trying to raise awareness about this kind of things, and they are doing a lot of works in regard. I submitted once a paper for this, and it was accepted. I think I had like 4, and they were published in a BMG. The other impact on the healthcare and the treatment, that self-medication may delay diagnosis, of course, and compromise treatment. So incomplete and appropriate antibiotic use can worsen certain infection. So it's not something that anyone wish to have. And also in the UK, current safeguard lines, antibiotic is only prescription. To ensure its safe use and its applicability. However, some pharmacists can prescribe for certain conditions after consultation. So there's some pharmacists who are in this role, whereby there's 7 common conditions that anyone can go for minor problems for pharmacist consultation, and they are in charge to prescribe or recommend the treatment that they think it could improve their condition. However, it's not improved, or there is any worsening of the condition, you need to go to A&E or go obviously to your GP. The other thing can be access and equality consideration. Say, for instance, migrant and underserved group may face barrier for the health care, and risk of informant channels or unregulated sources, like for instance certain shops are not licensed to prescribe or give antibiotic, but they still do that in certain places. Like for instance, I remember Eno, which is not antibiotic, but something for heartburn. It has been stopped in the UK for quite some time. However, you can get access to that either online or from certain pharmacy in different places and cities in the UK. The other thing is public education. And in terms of public education and policy, so public awareness of proper antibiotic use is kind of limited. So any policy should shift with require education, pharmacist oversight in order to not abuse the use of the antibiotic. and also not to get, for instance, complication of the antibiotic like pseudomonas and pseudomembranous formation because of the overuse of the antibiotic. So this is one of the things that should be considered when it comes to OTC for antibiotic. And the other one, it was about, assumably, there is a delay to access your GP. What can you do, or what other alternative routes that you could access the healthcare, and describe this, how can support the patient. So this one can be stemmed from different teams, like, for instance, the other alternative is obviously calling, if it's not emergency, calling 111. So it's a phone or online, which is available 24/7 for urgent, non-emergency cases. So you can get an advice, and people, they put you on the right service that you might need, or book out of hours appointment, or arrange emergency if needed. The other thing is pharmacists who are trained to advise on minor illnesses. The 7 common ones is cough, cold, rash, medication query, vaccination, rash, or anything. They can also provide emergency contraception and flu jabs. Also, the other thing, which is a nurse-led center or the walk-in center or urgent treatment center, they can offer services and care for the minor alignment or infection or injury, or urgent, non-life-threatening issue without needing for an appointment. So you just drop in, and they will allocate a number for you. The other thing, specialist, this is my nose, of course, from the nerve damage. I'm getting all the time this bout of block and stuffing. It's really irritating. There's nothing can be fixed anyway. So I'm going to continue. So the specialist NSS services, which mean, like, for instance, there's drop-in centers for STD, like sexual transmitted disease or sexual health issue, or physiotherapy services, or mental health crisis, and accessible directly without the need for the GP referral. So you just self-refer yourself. The other thing, you can go for private health care option if you have the ability. So private GP or clinic, which is faster access, of course, long consultation, more flexibility, patient pay directly or through their insurance, and private health insurance if you have one. This will provide, of course, quicker access as well to diagnostic or elective surgery, for instance, or specialist consultation, reducing waiting time compared to the NSH. So when I was assaulted on problem of my nose, no one addressed that or told me, and I was thrown between here and there. And obviously, after I got the complication, everything, I decided to go private in nearby London, and was told I'm having nerve dysfunction and nerve damage, and there's nothing can be done, and they should have rectified the issue early on, sadly. So yeah, this is the system. Anyway, the other option could be hybrid use, which some people use the NSH for routine care or pay privately for specific needs, like scans, dental work, or physiotherapy, so all sorts of things. And the other thing can be digital or community routes, which is imply online GB services, so it's a subscription-based platform, which offering video consultation, prescription, and referral. And of course, you're going to pay for that. Or community health services. It's a district nurse or midwife or health visitor can offer access directly for specific needs or demands. Or, of course, in certain places like charity or support line, like, for instance, for the mental health after the COVID time, or current condition or specific condition, like mine, diabetes, autism, elderly age, UK, you just name it. There's different variety of charity which can be used for different thing. One of the candidates mentioned that there is certain antibiotic taken for weight loss. I'm not quite sure what she mean by that, though I asked her, but maybe she meant different injection or like Manjaro, I don't know. Because the time is limited, so I didn't want to distract her. I just wanted to emphasize that there is nothing called antibiotic for weight loss. So all of those kind of thingy help in a way when you use it, of course, wisely and effectively, with a bit of knowledge, of course, or not be misinformed like nowadays things online, which is a lot of it. It's just misleading and misconception. So let me know down below if you have anything, or if you come across something like this, or you have any query in the comment. I'll come back to you. Thank you.